Today, we're diving into a paper that really challenges a core belief in hepatology, the idea that for patients with decompensated alcohol-related cirrhosis, the damage might not be a one-way street after all.
We've all seen it in our practice, right? A patient with cirrhosis develops ascites or encephalopathy or has a variceal bleed. They've decompensated. And for generations, we've been taught that this is it. This is the beginning of the end, a point of no return. But what if it's not?
For the longest time, the moment a patient's liver disease tipped over into decompensation, their prognosis just plummeted. The clock started ticking, and our focus, well, it shifted almost entirely to managing complications, and if they were a candidate, getting them on the transplant list.
And look, this wasn't just a grim outlook. This was the established natural history of the disease. The thinking was that the liver had crossed some kind of functional tipping point that it just couldn't come back from. But now, there's a growing pile of evidence that's starting to rewrite that entire story.
And this brings us to a relatively new concept, something that was formally recognized in the Bavano 7 consensus, hepatic recompensation. We're not just talking about stabilizing the patient here. We're talking about actual disease regression, a clinical reversal.
So, what is it exactly? Well, hepatic recompensation means the patient is no longer decompensated. The ascites is gone, the encephalopathy is gone, and this is crucial, their underlying liver function has measurably improved, all because the root cause, in this case, alcohol, has been taken out of the picture. The Bavano 7 criteria give us a really strict, measurable definition for this. It demands sustained abstinence, the complete resolution of those big decompensating events, without needing diuretics or lactulose, no bleeding for a whole year, and a significant improvement in their liver function scores, getting them back to a Child-Pugh A or a MELD score under 10. You know, it's a high bar, but it turns out it's achievable.
So to see just how achievable this is, let's turn to the heart of today's explainer. This big, multi-center study that set out to answer 3 key questions. How often does this actually happen? Who's most likely to achieve it? And what does it mean for their prognosis down the line?
And the scale here is really impressive. This is not some small, single-center observation. Researchers pulled data from 633 patients across 17 different centers in Europe and Asia, which gives these findings some serious weight and makes them pretty generalizable.
And here it is, the crucial finding. Within 5 years of achieving abstinence, about 1/3 of these patients with decompensated alcohol-related cirrhosis achieved full hepatic recompensation. Just let that sink in for a second. 1 in 3 patients reversed what we've always considered irreversible.
Okay, so this is the million-dollar question for us in the clinic. If 1/3 of patients can pull this off, how do we spot them ahead of time? What factors predict success? Well, the study found 2 really big ones.
The single biggest factor was how quickly the patients stopped drinking after their first decompensation. For patients who achieved abstinence within that first month, their chance of recompensation at 3 years was almost 38%. But for those who took longer, that number got cut in half, dropping down to just 19%. Time is absolutely critical here.
This graph from the study just illustrates the point brilliantly. The chart on the right, that's the early abstinence group, you can see that much larger blue area. That's the proportion of patients who recompensated. The difference is just so striking. It tells us there's a very real and a very early window of opportunity.
Now, the second key predictor probably won't surprise you. It was having less severe disease at baseline. Patients who showed up with just one problem, like only ascites, had a significantly better shot at recompensation than those who came in with multiple issues, like ascites plus encephalopathy.
So let's say a patient achieves recompensation. What does that actually mean for their future? This is where the study's findings become truly profound. It's not just about better lab values. It is about survival.
Read that again. 0 of the 197 patients who recompensated and stayed sober, not a single one died from a liver-related cause during the entire follow-up period. This is honestly one of the most powerful findings I've seen in a hepatology paper in a very long time.
The study's survival curves paint an equally stark picture. That yellow line shows patients who stayed decompensated. You can see that steady decline. But just look at the blue line for the recompensated patients. It is almost perfectly flat. That represents a near elimination of liver-related mortality.
And it doesn't even stop there. The other big sword hanging over our patients with cirrhosis is liver cancer, or HCC. So during the study, 16 patients who remained decompensated developed HCC.
And in the recompensated group, 0. Again, a complete nullification of that risk during the follow-up.
So what do we do with this information when we walk into the clinic on Monday morning? Because this study isn't just academic. It has immediate, powerful implications for how we counsel and manage our patients.
Okay, here are the crucial takeaways. First, we have to stop thinking of decompensation as this irreversible endpoint. It's just not. Second, we can actually tell our patients that a full clinical recovery is possible for about 1 in 3 of them. Third, the message has to be urgent. Stopping drinking within that first month is paramount. And finally, achieving recompensation isn't just a clinical goal. It's a life-altering event that practically eliminates their risk of liver-related death and HCC, as long as they maintain that abstinence.
And this leaves us with a really critical question, doesn't it? The data is crystal clear. The window of opportunity is narrow, and it is early. So the challenge for all of us is, how do we redesign our systems of care to give every single patient the support they need to achieve abstinence the moment they decompensate? That's the challenge this research puts right at our feet. Thanks for tuning in.